Well, hello, everybody. My name is Marcos Stafne. I'm the executive director of the Montshire Museum of Science, and it is my pleasure to host an amazing conversation today about the film Born to Be. We are so excited to welcome a number of amazing speakers who are willing to just share their minds and share their voices about this compelling film that features Dr. Jess Ting from Mount Sinai Center for Transgender Medicine and Surgery in New York, and the experiences that both his patients and he encounters as they travel on a really intricate and beautiful journey. And it's a very compelling film, and I am so lucky to have with us today Grace Alden, Val Werner, Dr. Benjamin Boh, and Dr. John Nigriny to discuss something that I just personally think is just a deep movie. It is so wide ranging in terms of all the topics that it covers, everything from gender, identity, rights, medical training facilities, how we learn medicine, how we work with patients, what patients' rights are. I mean, we can talk about sort of anything in the world here. I'd like to just start from the science perspective with our doctors here. Doctors, tell us a little bit about how difficult these procedures are and what these patients are going through when they get to this point. We're seeing a specific point in the movie, a specific point often where they're making a dynamic change, and we're looking at this, but this is just one point in a long journey. So what's actually happening here, and how difficult are these procedures?
I guess I'll start fielding that kind of question, but I'd like to preface anything I say by saying that, Dr. Boh and Dr. Turco have really been the leaders, at least here at Dartmouth, in the essence of managing these patients from an endocrine standpoint, and really being the platform that we are able to work off of in surgery. As the film points out, not all patients who go through gender transition wind up having surgery. And so Ben Boh, who's on the meeting with us today, actually, sees the full spectrum of patients. I see patients who ultimately want to undergo some sort of surgical transition. And those surgical transitions can range anywhere from what we call top surgery, where there's affirming surgeries to give the patient a gender identity of the chest, whether that's removing breast tissue or adding the semblance of a breast with breast augmentation, and what we typically anecdotally refer to as, bottom surgery, which is gender affirming procedures that can transform someone from male to female or vice versa. The latter types of procedures are very complicated, and as the film points out, you're undertaking really radical changes in transforming anatomy. The surgeries are, in essence, deconstructive. We, for example, take the penis apart and use its component elements to create female anatomy. The transition from female to male is a little bit different, but equally as complicated, especially when it gets into the phalloplasty arena that you've seen. That takes essentially a transplant to yourself. And we often, as the film points out, use the forearm as a donor site to create a neophallus. And a neophallus entails not only the external shape of a penis, but also the internal plumbing to allow urine to pass freely through it. To do that, and watching the film was really all the same issues that Jess Ting's group struggled with. We struggle with as well, from hair removal to coordinating appointments and stuff like that. But the hair needs to be removed from the skin. If the hair isn't removed, the urinary tube creates sludge or stones, and that can cause problems with what we call fistulas or leaks in the tube or obstructions. And so there's a lot of background work that needs to take place to have all of this stuff lined up and ready to go. But from a technical standpoint, the surgeries are very complex. They can be very tedious. This part of the body is prone to healing problems, which are very common in these surgeries. Most of the time, everything turns out well with just a little bit of time and local care, but sometimes revisions are necessary. There's not, up until recently, been any major types of training programs to specifically do this. Typically in plastic surgery, different disciplines in our specialty have concentrated on different things. I'm a microsurgeon. I also trained as a maxillofacial surgeon, so I have a lot of experience doing facial work and moving complex tissue transplants around the body, and that's how I kind of got into this business, so to speak. But in the past, there were leaders, and from I trained at Stanford and on the West Coast, and there are two people that I must point out that are pioneers in this surgical discipline, and those are Don Laub, who was the former chairman of plastic surgery at Stanford, who was really instrumental in developing some of the operations for bottom surgery. He was really doing this stuff in the 60s and 70s. And Doug Osterhout, who was a trained craniofacial surgeon, who's really pioneered all the techniques that we do for facial feminization and the like. But not to take up any more time, and I'm sorry if I'm rambling, that's kind of the essence of what we do, and it is complicated, I guess.
Yeah, and so just to expand on that, as John mentioned, I typically would see patients early in their transition, both transgender and gender diverse or non-binary individuals. I'm maybe one of the earlier people they meet along their journey. I see adolescents in addition to adults. Like my oldest patient recently turned 80 and maybe in their early 80s. And then I have patients that are just entering puberty, for which we are considering using a medication to block pubertal changes, which is very important progression in this field or advancement in this field, because as you got a glimpse of in the film, some of these procedures can be quite technologically, difficult and challenging and costly. So that's been one of my kind of real sort of drivers behind the work that I'm doing is trying to see adolescents and help to determine who's appropriate and eligible for being placed on a blocker. And then my other primary role is to see many adults who are interested in taking gender affirming hormones. That's again, not all patients are having surgery or taking hormones, but a pretty significant subset, and certainly most of my patients are at least on hormones or blockers. So that's kind of just a beginning sort of glimpse into my work.
Great. One thing that came up as I was hearing the sort of description of this, and you mentioned, John, the seminal work of doctors in the 60s and 70s, is that this is not a in this moment issue, right? This work has been happening for some time. So I'm curious, from Grace and from Val, your perspectives on just how this story is being told, and how there seems to be more media in the last 5 years about these types of experiences coming to the forefront and having a multitude of stories being told. It's still a very small percentage, of course, but it's a story that's been around for a really long time.
So one of the most important developments in the last 10, 12 years is that trans voices have started to be foregrounded. And so we are telling our own stories. For many decades, we had our stories moderated. We couldn't speak for ourselves. We were spoken for. And the result was that our lives and our accounts were seen through a cisgender lens, a cisgender understanding. And you get a much more complete picture when you go direct to the source and you talk to multiple trans and gender diverse people, and you're able to get the detail. So I applaud Sydney, who has made possible this discussion and who made sure to include trans voices in this. And one of the things that I saw in the film was that they foregrounded a lot of direct trans communication. They didn't try to curate it as much as I've seen in the past. So we got to hear directly from the people who were seeking the surgeries. And ordinarily I would excoriate a film a little bit for concentrating on surgery, because that's been kind of a preoccupation of cisgender people. But I really can't quibble about it when the topic of the biopic is himself a surgeon. So we can give him a pass on that point.
Val, any thoughts?
I agree about like the surgery angle. Like I was a little worried about it. I think like often these stories kind of get told as like oh, look how much like trans people suffer and like all of the things that they have to do to not suffer. And I think like this film actually avoided that for the most part, which I really appreciated. Like I was just kind of watching it and like just looking at the interesting surgeries that were happening. So that was pretty nice, actually. It felt like something that wasn't like being told just like for people like who had never heard of trans people before. It kind of was told like for trans people as well as cis people.
So one of the ways that we all get through life is humor, and it may not surprise people to know that this kind of film, trans documentaries, have been done so much to death that they have become rather hackneyed, and there exists a transgender documentary drinking game because so many elements are so common. And one of the first drinks in that drinking game is sad piano music, because inevitably we introduce, in that kind of framing, we introduce the trans person and all their success and so on, and then but John had a secret, and then in comes the sad piano music. And so when this movie opened, before I was able to get a full understanding of it, I thought, oh, well, that's interesting. They've swapped in sad cello music. But again, we have to give it a little bit of a pass because Dr. Ting is a cellist. So, okay, naturally you would want to foreground his musical ability and his musical interest. But my first reaction from the gut was, okay, here we go. We're right off the mark. And then the film surprised me pleasantly by managing to avoid a lot of the typical potholes and to take some of them and directly address them so as to defang them a little bit. So that was one aspect of the film that I enjoyed very much, that it managed to avoid some of what has become a rote.
I mean, it is in parts a documentary on this particular person who, of course, gets to Juilliard with 2 lessons on the cello. So that in itself is humorous to me.
Sure.
So he's an overachiever, that Dr. Ting. That said, I am curious about some of the public health issues that were brought up in this for the community, because that might be in the 4th act of this film. You start to see that. The mental health issues of one of the specific patients featured comes into play, where there is a conversation about sort of gender in our world, and how that still, even when these surgeries are completed or done, or I don't know if they're ever really completed, but they're still majority done, that it still doesn't necessarily solve all of the problems that might happen. And I'm curious to know, is that something that you might consider a trope, or is that something that's a real pertinent issue that we're seeing, and that could be answered from this whole group? Are we seeing it from a medical perspective, where mental health becomes a bigger part of our health issues when addressing trans community.
That is very current. I facilitate a local support group, and one of the things that we sometimes have to discuss and go over is that, you know, post transition, you're still you, and as much as success as you may have had in achieving your goals, and you know, there's a picture of Devon who is beautiful and feminine, which is what she wants to achieve. Nonetheless, it doesn't erase the trauma that you've gone through from living in a profoundly transphobic society and from having to interact with that society, not only in the past, but still going forward. You know, Devon, we find out in the movie that she has problems dating, and that's absolutely standard for trans women, that we when we date, we meet a lot of rejection. So I actually flagged when we got to the point in the movie where Devon said, "Everything I endured in childhood leading up to this no longer carries any weight." I literally, I quoted that and I wrote "uh-oh" after it, before we ever got to her later suicide attempt, because I understand why she would feel that way. It's a tremendous relief to achieve, just to get into the surgical suite to access whatever surgeries you personally need to access. The barriers to that are tremendous, and so it can be a sense of huge accomplishment and relief to finally be there and be able to, you know, lie back and count backwards from 10 and wake up later. But it's you're still going to be you on the other side, and the surgical outcome may change your life tremendously for the better. It's absolutely necessary, many of these surgeries, but they don't erase trauma. They just make it possible to live in the world in a different way.
Yeah, and from a clinical perspective, it is a very relevant point, and I'm glad that the film didn't shy away from some of these issues. And I think actually for a film that focused on the surgeon and surgeries, it did a really nice job of a sort of a glimpse into, I mean, it was 5 individuals, but it covered a lot of the issues that I see in my clinical practice. Very relevant. And unfortunately, that is an issue we deal with, is that everything is not fixed necessarily. You know, lives can be bettered, but we can't erase that trauma, as Grace was mentioning. And I often, especially in older patients, but I'm sure this applies to young patients as well, there can be a significant childhood trauma, just a lack of acceptance and a stigma that folks are working to overcome.
How does that get magnified? Put in here. How does that get magnified in a rural environment? So we're thinking of the film, of course, is, you know, set in New York City, and there's a different type of vibe, we'll say. And here we are in you know, the Upper Valley of Vermont and New Hampshire. And how is this community supported? How, as doctors, are you supporting this community at DH? Like what's actually happening here?
Yeah, so it takes a team approach. I mean, I see patients from really all aspects. A lot of my patients are actually coming from Manchester, Concord area, and certainly I see a large number of patients in rural communities. The supports are not as great for my patients that are coming from isolated. I routinely see adolescents, children, and young adults who've never met another trans individual. And that, you know, I don't see that as much for my families that are coming from, you know, Massachusetts or Southern New Hampshire. So we do struggle with that here. We're in the process of building a truly multidisciplinary clinic, but it takes a lot of work, and it takes funding, and that's something we've been working hard at, and hope to expand that. And then certainly there are people in the community like Grace and other individuals who are running support groups, which is really been kind of one of the entry points for a lot of these individuals is you know, finding a group of individuals that are like-minded and have had similar experiences.
John, we're having trouble hearing you.
Can you
now we can. Yes, we can.
I'm sorry about that. So, you know, my experience in a rural environment has been, you know, interesting in the sense that I'd echo some of Ben's comments. We have patients that can be very isolated, both old and young. The access to social media and the internet does give them, I think, a bit more ability to interact with others around the country. But the population density can create some isolation in these folks, and and sometimes it's very difficult. And I've had patients from deep rural Maine who were just so excited that they found someone that could help them from a surgical standpoint after being kind of passed from physician to physician, or attempts to find a provider who could help them in some way. And I think part of our scope in the development of a more cohesive transgender center that we're creating here at Dartmouth is to give the population of our service area the ability to use us as a platform for information and support together. And I think that'll be an important component of it.
I want to lift that up a little bit. When I first went through college, I graduated in 1991 and the internet didn't exist. And finding information was just tremendously difficult. Fast forward about 15 years, and I finally was able to start searching again, and I found, oh my goodness, we had an internet and Google, and we had trans people speaking with their own voices, and all of a sudden information was everywhere. The internet has been a tremendous boon for trans people in a wide variety of ways, and one way that is sometimes a little bit subtle and probably something that our doctors here maybe have to grapple with a little bit is that trans patients often come in very informed, not always, but very often loaded for bear and ready to deal with doctors who might be inclined to be gatekeepers and to be barriers to care. And I don't think that describes either of the doctors present, but they are working in an environment where sadly a lot of their colleagues have poisoned the well for them by being unwelcoming and being rejecting. And so trans people, when we try to access medical care, we're entering, each time we meet somebody new, meet a new care provider, we're potentially accessing a dangerous and weaponized environment. And so we do it cautiously. And I'm sure that is a challenge, particularly for Ben, who's seeing people early as they try to access hormonal care.
Yeah, certainly there can be walls that need to be broken down. Because having that trust and that rapport is really vital for, I think, both from the surgical aspect, but from the medical aspect as well. And just to give some perspective, transgender people have been receiving medical care since the 40s and probably more realistically the 50s, but some of the first patients in the late 40s. And there really was a system that was designed to be a gatekeeper. I mean, the goal at that point was really to not see regret and to make sure people were vetted very vigorously and from our lens now inappropriate in many ways, but for the time it was quite advanced and quite progressive. Some of these physicians and surgeons that were doing this work, and certainly as I think I've really seen that progression, because when I started both as a medical student resident and I think more specifically as a fellow, there was still a very regimented process, and that's really changed significantly in my 10 years or so of working very directly with gender diverse patients, and it's been a wonderful change. I love that patients come well informed. I think that it makes for a challenge in one end, but it makes for it's more rewarding from my standpoint in many ways. I enjoy that. The transgender patients in many ways are like patients I see who with infertility, they come with really a game plan and they're very motivated. And I actually love that. That's one of my favorite aspects of those fields. But
yeah, it's worth calling out that in the 50s, 60s, 70s, I would not have been permitted medically to transition. I doubt that, I'm 6'2" and I'm athletic and I'm a lesbian. And so, those were all, they would have looked at me and said, well, you can't possibly ever pass as cisgender, so you're always going to be miserable, and we're not in the business of creating homosexuals. So that would have been the attitude that the medical establishment at the time would have approached it with. So in some way, I'm very fortunate in that I was able to hang on until times have changed, and now we have medical professionals who are taking a much more human and humane approach. And I noticed that in the movie, they ask early on Dr. Ting how he got into this work, and he says, well, they asked everybody and everybody else said no. And that resonated with me. I've heard that from many medical professionals that, essentially everyone else stepped back, and because I was willing to treat trans people like they're human beings with medical needs rather than freaks, all of a sudden, word of mouth, a lot of trans people started showing up on my doorstep. And so very often people who specialize in trans care find that they specialize precisely because we seek them out, because we talk to each other. And it's not difficult to, if you're able to treat people well, it's not difficult to build a practice around trans people, because once people know that you're going to treat them with humanity and respect and be conscientious in their medical care, you're going to get flooded.
Val, I see your head nodding a lot on this. Would you like to elaborate on that?
It is really difficult to get that kind of information because there's not a lot of information out there about, like, if you're trans, like, how can you get, like, these doctors. Like, the best information that, like, I've gotten and, like, other students at Dartmouth have gotten is, like, because we all kind of, like, have gotten together and, like, are sharing knowledge with each other. And, like, if we didn't do that, we would have nothing. And so, like, I didn't even know, like, I got top surgery at DHMC, and I didn't know that was a possibility for a while until I just made, like, a random phone call. And that was also, like, that was a big deal for me because I didn't realize that I wouldn't need letters to get surgery there. I'd, like, been turned down by surgeons before for not having enough, like, letters saying that I needed the surgery. So yeah, I guess it's hard to find that kind of thing without word of mouth.
And how do you think, we're in a specific moment with the pandemic and not being able to meet in person for the majority. And I know that you wrote something, in terms of, like, how can students, for example, get support when a lot of these networks have disbanded? Have you seen people, like, avalanching into more online support networks or groups? How do you feel that this is affecting especially young people right now who aren't able to see each other in person or have these types of really personal conversations, or having to have them over Zoom or FaceTime?
I think it's hard because, like, if we're not seeing each other in person, like, especially for, like, the like, newer students who, like, haven't met most of us in person, it's hard to, like, have really any trust, and, like, you kind of have to, like, be vulnerable a little bit and share personal information. People don't want to do that with people they've never met, or they met, like, once or twice in person. So that's making it harder. Like, even if we have, like, online communities, it's harder to use them.
And for the doctors here, is telemedicine in this field right now, is that surged, or are you still seeing patients in person for the most part?
So I think it's a combination for most of us. I've actually done a lot of telemedicine early in the pandemic. My wife was expecting, and I also see a number of patients who are at very high risk due to their age and other comorbidities. So I had many opportunities for telemedicine, and actually in many ways, so there are limitations to it, certainly, but it's actually been great for some of my patients that have difficulties with transportation or getting to the medical facility. So in some ways, it's actually, I think they could probably look that the numbers of referrals have actually gone up in some ways. But I also see, especially young people who've really been struggling with the isolation component, and I think probably it's disproportionately, it's from the pandemic standpoint and mortality, morbidity, it's affecting our elderly patients the most, but probably from a psychological standpoint, this is most difficult on young people. And I'm glad to see things sort of opening up, and with restrictions and social distancing, because I think teenagers need need that socialization with peers.
Yeah, we're definitely seeing I'm sorry, Dr. Nigriny, you started to talk. Go ahead.
Problem. In plastic surgery, we certainly are using telemedicine and seeing a lot of patients virtually. Yesterday, I think I saw 10 patients on telemedicine. It has really, especially in our catchment areas, opened up the opportunity for patients to get specialty consultation and care that wouldn't otherwise be able to travel. I talked about patients in northern Maine and rural Vermont and all these other kinds of folks who lack ability for transportation. And a lot of the consultative services can be done effectively in a remote fashion, and it's really, I think, opened up the ability of patients to really seek care. And I think it does also curb some of the anxiety of an in-person visit, and gives patients the ability to feel more comfortable in their home surroundings, talking about something that may be psychologically very difficult for them to express. Not always, and I would agree that a lot of the patients are very well informed, have a lot of information, and have a lot of friends out there. A lot of the patients I see are being referred by friends or other folks that I've operated on, and the network that exists is really amazing and profound. I'm not really one that utilizes social media at all, so I'm a bit of a Luddite in that sense, but I'm continually impressed at how much information they have, not only about the surgeries, but about me. And that, I have a patient that I operated on, and he said, "Well, you're really exploding on social media." And I said, "What does that mean?" And he's like, "Oh, well, it's all good. All these positive things are coming out about the surgical experiences at Dartmouth." And I said, "Oh, well, that's great. I have no idea that any of this is even happening or in existence." So it's refreshing, and throughout my experience of taking care of patients with these problems, they have to be one of the most appreciative groups of folks that I've ever come across, and it's really been my pleasure, and I'm sure it's been Ben's as well, to help.
Absolutely. Incredibly rewarding work. And it's true, if you do this long enough, you're going to have, Reddit threads and Facebook posts, and there's no avoiding it. So you better do right by the patient, or it's going to reverberate back.
Not to scare Dr. Nigriny, but totally outside of social media, it happens that I know two people who have scrubbed in with him on different surgeries, not necessarily trans surgeries, and I know at least one person whom he has operated on, and that was all just organically, and I'm not particularly connected. Yeah. So the network of information, it's a survival network. We have developed this talking to each other, and it's a whisper network that can be used for good or evil. It tells us which doctors to stay away from, and it tells us which doctors we're not going to get rejected by.
In our closing here, this has been such a fruitful conversation, and it's given us a lot to think about. I'd love to if each of you could just send one message of, we have this film, it's a point in time, it's reflective of what is happening in the last year or so. What do you hope for the future? Like, what do you hope for the future in terms of medicine, in terms of what we want society to be like? How can we sort of take the themes of this film and sort of give a message out to say, we wish that it would be different, or we wish it could be something else?
One of the messages that I have learned to give when I am part of a presentation that Dr. Turco regularly does for Geisel Medical School students, the main message that I try to get across to them is that trans care is not optional. We represent probably roughly about 1% of the population. You know, the adult estimates come in a little under that, but the child estimates come in a little over that. So we're probably in rough figures around 1% of the population. And that means that no matter who you are as a medical professional, you're going to be interacting with trans people. A lot of the time you won't know it because we won't tell you. We may decide that you don't need to know for, you know, the hangnail or the we've put a nail through our hand or something. Sometimes we will decide erroneously that you don't need to know, and you did need to know to diagnose that abdominal pain correctly. So it creates a barrier to care. But the main thing is for taking that barrier down is that medical professionals understand that trans people are human beings and we need care. And sometimes that care is related to the fact that we're trans, and very often it is not at all related to the fact that we're trans. It's not optional. And what I've told the med school students point blank is if this is going to be a problem for you, if you're going to struggle interacting with trans people and the fact that we have bodies and that those bodies may not be quite what you expect sometimes, maybe you'd be better in another line of work.
Mm.
Yeah, so I would offer just hope for the community and also for future providers. I'm particularly passionate about seeing, you know, adolescents and helping to decide and implement puberty blocking medications, which I think can avoid some degree of surgeries in the future. And so I think a message of hope that, you know, both we're advancing in the field, there are more of us providing care, there are more choices and options than ever before, and you know, the surgery that was well outlined in the film, that the surgeries are progressing at quite a rapid pace. That's very exciting and hopefully reduce complications. So I'm very hopeful about the future. I've seen such dramatic change in just the 10 to 12 years that I've been practicing, that I anticipate that pace to continue.
Thank you.
Well, from my standpoint, I think there are 2 points that I would hope or look forward to in the future. And I think one of those was touched on in the film, and that's from a surgical standpoint, there is still evolution, and we're continually honing the practice of transgender surgery. And I think it will continue to get better in the future. And as more people embrace it as a surgical discipline and perform it, I think, you know, that innovates the entirety of us, and also gives us the opportunity to reduce complications. I also hope for the future that rather than needing to have these conversations of almost an us and them situation, that we're all just kind of on the same playing field, we're all them, and that being a trans person is no different than, you know, being a person with some other societal issue, and that it's I find sometimes in that conversation it creates somewhat of a polarizing nature of interaction, and I would hope that it's just a much more even, equitable, and all-inclusive group. Patients, providers, the general public. So.
I agree. And I think it's important to have a lot of like exposure to like trans concepts and to trans people, and have a lot of conversations like this, and have like films like this, because like otherwise we're not going to get to a point where like a trans person can go to a doctor and like know that doctor is not going to be super weird about them being trans. So yeah, I guess like continuing to have conversations and awareness and education is probably the most important thing to me.
Wow. Well, thank you all so much for your voices and for your minds and your thoughts on this film. I want to thank the Hopkins Center for hosting this and for bringing together this great group of people to discuss the film Born to Be. And I hope this film gets watched. I hope that people have big thoughts when they see this film, and I hope that it helps with representation and just getting the word out. So thank you so much. Again, I'm Marcos Stafne with the Montshire Museum of Science, and this is with the Hopkins Center. And again, we hope to see you soon and enjoy the movie.
Thank you.
Thank you for having me.